So in the Stryker joint replacement team, we're generally set up with an area director. So we have an area director for North, which is Queensland and New South Wales. We have an area director for South, which is Victoria, Tasmania, South Australia and WA. And under that person is the regional manager team, which I'm a part of. So specifically in Victoria, we have 3 regional managers and I also look after the Tasmanian business. And then we have a group of sales people and associate salespeople or territory managers and associate territory managers who work with them, as well as our MPS and our clinical field support. So generally the territory managers are responsible for doing all the bookings that come through from the surgeons' rooms or hospitals. They ensure that all the loan kits and implants are going to arrive at the hospital on time, and they will then sort out the case coverage about who is going to be at what cases and where, and again that's making sure that we have the right people in the right places, and that's to do with both our employees' skills and clinical kind of expertise, but also meeting what the surgeons' needs are and who they want in their theatre and who meets their needs. So that's how we're set up a little bit from a structure point of view, and we all fit under our joint replacement director, Emmy Holt. So the territory management position is responsible for the sales budget. So Stryker is a sales company. We aim for growth every year, and the territory manager will carry a budget, a number that they're aiming to hit. The day-to-day role of a territory manager will be organising their bookings, spending some time around administration, ensuring that the communication with surgeons' rooms or hospitals is thorough, and that the instrument kit arrives, the correct implants arrive, and that they're responsible for sorting out the case cover and organising the clinical team. So it's a really varied role, the territory management role, but ultimately it's about hitting their sales number. The associate territory manager role is how most salespeople will come into our business. So it's really an opportunity to learn and understand what is required to be a successful salesperson at Stryker. They will generally shadow one of the territory managers or work with one of the more experienced territory managers. And that's a real benefit of being at Stryker, is we have a big team full of varied tenure and people that can work with you and really help you along your journey. So that's what the associate territory manager role is. They are in field a lot covering cases because clinical expertise is really important, and the territory manager does that as well. The associate manager is a theatre role as well, so but they'll learn, they'll sit in on our sales meetings, they'll maybe be given like a little kind of territory that they can look after, or a couple of surgeons that they can really concentrate on honing their sales skills and working with them around that. But it's a great role in terms of entering the business and understanding the sales process at Stryker. And then the MPS role, or clinical support role, is for our clinical team who are looking after the Mako robot, particularly. That is a real kind of growth area of our business. And their responsibilities include the bookings and ensuring that the patient's scans before the patient have their operation are all done correctly and are all uploaded into our software. They're responsible for planning the case and then taking that plan. So when we talk about planning the case, that's about ensuring that the implants are aligned properly in the patient, and that's the benefit of Mako. We can do that before the patient's on the table and the surgery's even started. So the MPS is responsible for doing that and then taking that plan to the surgeon and having a consultation with the surgeon. Now that might be in the days before the case, or it might be just in the few minutes before the case starts, just depending on the experience of the surgeon and the MPS. And then they're responsible for covering the case. So setting the robot up, helping the nurse with how the instruments are put together appropriately, interacting with the surgeon about their needs and any questions that they have, and ensuring that the robot works correctly. And so that's a big but really interesting role, and there's a lot to learn initially, but it's a really kind of fulfilling role.